Hi everybody, I'm Pete Miller, your Chief Executive. This is the April team brief about things that are going on at the moment in the Trust and in the wider NHS. So what's really important to the wider NHS at the moment? Well, at the end of last year we had the 10-year plan which talked about the importance of mental health, which talked about the importance of community services, which talked about the importance of primary care being the centre of the NHS, and we need to be able to respond to that in the organisation to improve our mental health services, our community services offer, and to link more closely with primary care. On the back of that is going to be a new workforce strategy, which will come later this year, about how we're going to be able to fill all of those vacancies, how we're going to be able to create new roles, how we're going to invest in people's training, how we're going to invest in nurse training, AHP training, medical training, to make sure that we have enough people to provide the services that we want to provide over the coming years. So what's happening across Leicester, Leicestershire and Rutland? Well, we're responding to that, so we'll be producing a plan in the autumn of this year based on the contract that has been negotiated and agreed for next year, how we are going to develop that, how we're going to develop our more integrated locality-based offers, how we're going to develop our community services, and how we're going to develop our mental health services to be able to respond to those increasing demands, and the increasing demand of primary care to work more closely with them and work more closely in an integrated fashion with our social care colleagues as well. Okay, that brings us down to the organisation. It's April, and April is a time when we reflect on the previous year. On a positive note, we delivered all of our financial targets. We created a surplus of £3 million on a total budget of £275 million. Which was a good achievement, and it's good to be financially sustainable. However, we've got much more work we need to do on ensuring the quality of the services that we provide are what we all want to be able to provide. It was great to see that the staff survey had improved, but we know that hides how busy people are and how much that they want to be able to provide that service, but sometimes don't have all the resources and the people that we need to do that, and that's why we've got to work closely with our commissioners to make sure our services are accessible and people wait the minimum amount of time and that we can provide the sort of services that we want to provide. So coming into this year, what do we want to do? Well, we want to focus on some real key priorities, making sure we get things right first time, especially on our wards, especially in our community teams, how we manage medicines, how we manage clinical care. But we also want to do that with the right culture, and so we've launched a cultural programme, and we asked people to volunteer to be cultural change agents, and 92 people have volunteered so far, and there'll be training for those individuals on the 1st and 2nd of May, and then they'll be getting out into the organisation to do a diagnostic, to work out what we need to change, what we need to do differently. And alongside that will be the work we're doing about race equality as well, to making sure every member of staff feels they get equal opportunities and gets treated fairly in the organisation. And that's an important piece of work under the leadership of our new Equality and Diversity lead, Hasib, who no doubt many of you will be meeting over the coming few months. So alongside those big cultural pieces of work, we want to focus on our abilities to do quality improvement and do improvement everywhere in the organisation. Especially around our big transformation projects. We know we need to transform the way in which adult mental health works and all of our mental health services, but we also got transformation work in our children's mental health services and our community services, which are working more closely in an integrated fashion with our primary care colleagues. I'll just finish, always a good time of year as well, to celebrate those things that have gone well, and so at the beginning of May we'll be having the Celebrating Excellence Awards, and we've had loads of nominations, and all the people that have been shortlisted now are aware, and we'll be all meeting together to have a wonderful award ceremony in May, and I'm really looking forward to that. As I said last month, I'm retiring this summer, but I'm working hard at the moment to try and achieve those CQC improvements. CQC will be back to look at some of those immediate improvements that we needed to make in June or July, and I'm trusting that we will have made the significant improvements we need to do by then. And then once we've done that, then I'll be on my wind down towards my retirement, and I look forward to seeing you all before I go. Thank you.